Question 1. In the context of pediatric imaging and following the ALARA as low as reasonably achievable principles, consider the following scenario. Mr. Johnson, the 7-year-old boy, presents to the emergency department after a minor head injury incurred during a playground accident. His clinical evaluation suggests the need for a head CT to rule out intracranial hemorrhage. However, his young age mandates careful consideration of radiation exposure. The radiology team must decide on the optimal CT protocol that balances diagnostic image quality and minimization of ionizing radiation. Given the sensitivity of pediatric tissues to radiation and the established guidelines from the American College of Radiology (ACA), which protocol adjustment is most critical to ensure compliance with ALARA principles while still achieving sufficient diagnostic clarity in this situation? A. Increasing the tube current to ensure high-quality images. B. Reducing the tube voltage and current while using iterative reconstruction algorithms. C. Maintaining standard adult CT protocols regardless of the patient's size. D. Utilizing a longer scan range to capture all possible pathology. Answer. Correct answer. B. Explanation. In pediatric CT imaging, especially for a child like Mr. Johnson, it is imperative to minimize radiation exposure due to the increased sensitivity of developing tissues. The ALARA principle emphasizes using the minimum radiation dose necessary to achieve adequate diagnostic quality. Reducing the tube voltage and current in combination with advanced iterative reconstruction techniques helps maintain image quality while significantly lowering radiation dose. Increasing tube current or using adult protocols would unnecessarily raise the dose, and extending the scan range may lead to additional unwarranted exposure. The American College of Radiology (ACA) and other pediatric radiology guidelines recommend dose optimization strategies such as these. Therefore, option B best encapsulates the ideal approach in this clinical scenario, ensuring both patient safety and diagnostic efficacy. Question 2. According to recent studies, Ms. Rodriguez, a 4-year-old patient, is scheduled for an abdominal ultrasound due to suspected appendicitis. Because the child is naturally anxious and prone to movement, the imaging team must prepare her adequately to ensure a high-quality examination. The radiology department has several sedation protocols and non-pharmacological strategies available to minimize motion artifacts during the procedure. Situation: what should be the radiologist's primary consideration in choosing a sedation or patient preparation strategy? The choice should reflect a balance between safety, effectiveness, and adherence to the pediatric sedation guidelines as per the American Academy of Pediatrics (OP). A. Using the maximum sedation dose immediately to ensure the patient remains motionless. B. Relying solely on physical restraint to prevent movement. C. Utilizing a tailored sedation plan combined with age-appropriate distraction techniques after assessing the patient's medical history and fasting status. D. Scheduling the examination later in the day when the patient is more likely to be tired. Answer. Correct answer. D. Explanation. This question focuses on the preparation of pediatric patients for imaging procedures, emphasizing the importance of following established sedation guidelines. While ensuring minimal motion is essential for diagnostic quality, patient safety must always be the priority. Option C might initially seem appropriate. However, recent studies and OP guidelines suggest that tailoring sedation involves not only pharmacological intervention but also careful scheduling and non-pharmacological measures. In this case, scheduling the procedure when the patient is naturally more relaxed or tired. Option D could reduce the need for heavy sedation and minimizes associated risks. This strategy aligns with a holistic approach, pediatric care. The decision must be made after a thorough assessment of the patient's medical history, fasting status, and anxiety level. Hence, option D is considered the correct answer as it encapsulates safe and effective strategy. Question 3. Based on the information, Dr. Patel is reviewing the CT protocols used for imaging a 10-year-old patient with suspected inflammatory bowel disease. The child's history indicates previous episodes of abdominal pain and elevated inflammatory markers, and CT is considered for detailed assessment after inconclusive ultrasound findings. The radiology team is concerned about cumulative radiation exposure in pediatric patients, exploring dose optimization techniques. Which strategy should be prioritized to minimize radiation dose while still obtaining diagnostic images for the evaluation of bowel inflammation? A. Employing contrast-enhanced studies at full adult settings. B. Increasing the pitch and using automatic exposure control without modifying other parameters. C. Lowering the tube current and voltage, employing dose modulation and using iterative reconstruction algorithms. D. Extending the scan range to ensure no pathology is missed. Answer. Correct answer, C. Explanation. For pediatric patients, reducing radiation dose without sacrificing image quality is the critical aspect of CT imaging. Option C is correct because it involves a combination of lowering tube current and voltage, which directly decreases radiation dose, while dose modulation tailors exposure based on patient anatomy. Iterative reconstruction algorithms further enhance image quality despite the reduced dose. This approach is in line with current recommendations for pediatric CT protocols from both the ACA and the Image Gently Alliance. Options A and D are inappropriate as they either expose the patient to unnecessary radiation or extend the scan range, while option B may not sufficiently address the dose reduction needed. Thus, option C is the most comprehensive strategy for ensuring the child's safety while still providing diagnostic efficacy. Question 4. When considering pediatric fractures and the possibility of non-accidental trauma, imagine the case of Mr. Thompson, a 3-year-old boy who presents with multiple fractures at different stages of healing. His clinical history and social background have raised concerns about possible child abuse. As a pediatric radiologist, what is the most appropriate next step in imaging evaluation and communication with the clinical team to ensure accurate diagnosis and the safety of the child? The decision should reflect a thorough understanding of the legal and ethical responsibilities in such cases, as well as compliance with guidelines for suspected NAT cases. A. Immediately perform a skeletal survey and alert the Child Protection Services, documenting all findings meticulously. B. Order only localized radiographs of the most recent fracture site to limit radiation exposure. C. Delay the imaging evaluation until further clinical details are available. D. Rely solely on the patient's history and forego further imaging. Answer. Correct answer, A. Explanation. In cases of suspected non-accidental trauma, it is essential to perform a comprehensive skeletal survey to evaluate for occult fractures and assess the injury's pattern. Option A is correct because it emphasizes immediate action by conducting full skeletal survey, which is the standard protocol in pediatric abuse cases. This step not only assists in diagnosing potential child abuse, but also ensures that all injuries, even those in various healing stages, are documented. In addition, notifying Child Protection Services is legal and ethical obligation, and meticulous documentation supports any subsequent investigations. Options B, C, and D are inadequate because they risk missing additional injuries, delaying diagnosis, or failing to protect the child, respectively. The guidelines from the American College of Radiology and Child Welfare Protocol strongly support the approach outlined in Option A. Question 5. Through the lens of pediatric brain imaging, consider the scenario of a 12-year-old patient presenting with new-onset seizures and subtle neurocognitive changes. The referring neurologist has requested an MRI to evaluate for potential cortical dysplasia or other structural anomalies that may contribute to the patient's condition. Given the challenges inherent in pediatric brain imaging, including the need for sedation and the potential for motion artifacts, what should be the primary focus when planning the MRI study for this patient? A. Prioritizing speed of acquisition over image quality to reduce motion artifacts. B. Optimizing imaging sequences with fast acquisition techniques and considering sedation protocols as needed. C. Using standard adult MRI protocols without modifications. D. Delaying the MRI until the patient can remain perfectly still without sedation. Answer. Correct answer, B. Explanation. Pediatric brain imaging poses unique challenges, particularly in patients with neurological symptoms like seizures. Option B is correct because it emphasizes the need to optimize MRI protocols by incorporating fast acquisition sequences that help minimize motion artifacts while retaining diagnostic quality. Additionally, the judicious use of sedation, when clinically indicated and carefully monitored, ensures that the patient remains still during the examination, which is vital for accurate image acquisition. This strategy aligns with best practices outlined by the American Academy of Neurology and Pediatric Imaging guidelines. Options A and C fail to address the nuances of pediatric imaging, and option D might unnecessarily delay critical diagnostic evaluation. Hence, balanced approach as outlined in option B is essential. Question 6. With respect to the imaging of neonatal infections, consider the following scenario. MS. Lee, a neonatologist, is concerned about a premature infant in the neonatal intensive care unit NICU who is exhibiting signs of sepsis and respiratory distress. The neonate's clinical picture suggests the possibility of pulmonary infection that may have spread to the abdomen. The radiology team must decide which imaging modality and protocol adjust are most suitable for this vulnerable population to both diagnose the infection and minimize the risks associated with radiation exposure and sedation. What is the most appropriate imaging strategy for evaluating this neonate? A. Performing full-dose CT scan of the chest and the abdomen immediately. B. Utilizing conventional radiography with multiple views despite potential radiation risks. C. Initiating tailored ultrasound examination of both the chest and the abdomen, avoiding ionizing radiation entirely. D. Delaying imaging until the infant's condition improves to reduce potential sedation risks. Answer. Correct answer. C. Explanation. Neonatal imaging requires careful consideration due to the heightened sensitivity of neonates to both radiation and sedation. Option C is correct because ultrasound provides a radiation-free imaging alternative that is well suited for evaluating soft tissue infections, fluid collections, and other abnormalities in both the chest and abdomen. Ultrasound is especially beneficial in the NICU setting where the avoidance of ionizing radiation is paramount. This approach is consistent with current recommendations from the American Institute of Ultrasound in Medicine (AM) and other neonatal imaging guidelines. Options A and B expose the neonate to potentially harmful radiation, while option D might compromise timely diagnosis and management. Thus, using the tailored ultrasound examination, option C best meets the clinical needs and safety requirements for this case. Question 7. Based on the information, consider the case of Istanuan, a 6-year-old boy who presents with recurrent urinary tract infections and has been referred for imaging to evaluate for possible vesicuratal reflux (VER). His clinical history includes several episodes of febrile urinary infections, and there is concern for renal scarring as a long-term complication. The imaging team must decide on the most appropriate modality and image protocol to accurately diagnose VER while adhering to pediatric radiology guidelines. What is the most recommended approach for imaging in this scenario? A. Relying on conventional abdominal radiography with contrast. B. Using non-contrast CT scanning to minimize radiation exposure. C. Employing magnetic resonance urography (MRU) as the first-line study. D. Conducting avoiding cystourethropy (VCUG) with careful dose optimization and radiation safety measures. Answer. Correct answer D. Explanation. Avoiding cystourethropy (VCUG) is the gold standard for diagnosing vesicuratal reflux (VER) in pediatric patients. Option D is correct because it specifically addresses the need for an imaging study that can dynamically evaluate the urinary tract during voiding, which is critical in assessing reflux. Although VCUG does involve exposure to ionizing radiation, the imaging protocol can be optimized to minimize the dose in accordance with ALARA principles and pediatric radiology guidelines. The American Urological Association and the Society Pediatric Radiology endorse VCUG for this clinical scenario. Options A, B, and C either do not provide the dynamic functional assessment required or may not be as readily available or effective in children. Thus, option D is the most appropriate approach. Question 8. Under the assumption that neonatal chest and abdominal imaging plays a crucial role in the management of critically ill infants, consider the case of MS. Carter's newborn, preterm infant with respiratory distress and suspected necrotizing enterocolitis (NEC. The clinical team requires immediate and accurate imaging to assess both the chest for pulmonary complications and the abdomen for signs of NEC, including pneumatosis intestinalis. Given infant's fragile condition and the need to avoid unnecessary sedation and radiation, which imaging modality and approach should be considered most appropriate in this situation? A. Initiating series of carefully planned conventional radiographs to evaluate both the chest and abdomen. B. Proceeding directly with high-resolution CT scan to obtain detailed images. C. Utilizing MRI to capture all necessary details in one session. D. Opting for ultrasound evaluation of the abdomen while using limited chest radiograph only if absolutely necessary. Answer. Correct answer A. Explanation. In the context of neonatal chest and abdominal imaging, particularly in preterm infants at risk for conditions such as neck and pulmonary complications, conventional radiography remains the first-line imaging modality. Option A is correct because serial radiographs can be performed with minimal radiation exposure, especially when dose reduction techniques are used. This method provides rapid and essential diagnostic information that is critical for timely intervention. CT and MRI, although valuable, are less practical in this vulnerable population due to the need for sedation, MRI, and higher radiation doses, CT. Ultrasound option D is excellent for certain abdominal conditions but does not reliably evaluate chest pathology in neonates. Hence, option A offers a balanced, safe, and effective diagnostic approach. Question 9. The general consensus is that pediatric liver and biliary imaging demands a careful balance between achieving diagnostic accuracy and minimizing invasiveness. Consider the case of Ista Allen, a 9-year-old boy with a history of right upper quadrant pain and abnormal liver function tests. The clinical suspicion includes conditions such as biliary atresia or congenital hepatic fibrosis, and the referring physician requests imaging studies for further evaluation. Given the potential risks associated with sedation and contrast administration in children, what imaging strategy is most appropriate to assess the liver and biliary tree in this patient? A. Relying exclusively on CT imaging with contrast enhancement. B. Utilizing ultrasound as the first-line modality with possible follow-up cholangiopancreatography (LCP) if needed. C. Initiating an immediate invasive cholangiography. D. Waiting until the patient is older to obtain clearer images. Answer. Correct answer B. Explanation. For pediatric liver and biliary imaging, ultrasound is widely recognized as the first-line modality due to its safety, non-invasiveness, and effectiveness in identifying structural abnormalities. Option B is correct because it outlines a logical diagnostic pathway, starting with ultrasound to evaluate the liver parenchyma and biliary system, with MRCP reserved as follow-up if further anatomical detail is required. This approach minimizes radiation exposure and sedation risks while still providing high diagnostic yield. CT imaging and invasive cholangiography are generally reserved for more complex cases, or ultrasound findings are inconclusive, and delaying imaging option D could postpone necessary treatment. This protocol is supported by guidelines from the American College of Radiology, ACA, and Pediatric Hepatology Societies. Question 10. In the modern context of pediatric neuro-oncology, consider the scenario of MS. Green, whose 8-year-old daughter has been experiencing persistent headaches, visual disturbances, and subtle cognitive changes. The referring pediatric neurologist is concerned about the possibility of a brain tumor, particularly in association with a neurocutaneous syndrome such as tuberous sclerosis. Advanced imaging is necessary not only for diagnosis, also for surgical planning and subsequent management. In this challenging case, which imaging modality and protocol should be prioritized to ensure optimal visualization of both parenchymal abnormalities and potential neurocutaneous manifestations, while mitigating risks related to sedation and motion artifacts in a pediatric patient? A. Initiating the workup with a contrast-enhanced CT scan. B. Using diffusion-weighted imaging GUIA alone as the primary modality. C. Relying solely on ultrasound imaging of the brain. D. Performing an MRI with dedicated neuro-oncologic protocols, including FLAIR and contrast-enhanced sequences with appropriate sedation if necessary. Answer. Correct answer D. Explanation. In pediatric neuro-oncology, especially when evaluating conditions potentially associated with neurocutaneous syndromes, magnetic resonance imaging (MRI) remains the modality of choice due to its superior soft tissue contrast and ability to delineate detailed brain anatomy. Option D is correct because it describes a comprehensive MRI protocol that includes FLAIR and contrast-enhanced sequences. These sequences are critical for identifying both parenchymal lesions and any associated abnormalities that might be seen in neurocutaneous disorders such as tuberous sclerosis. Although sedation may be necessary to ensure image quality in younger patients, the benefits of obtaining high-resolution images out the risks when performed under controlled conditions. Options A, B, and C do not provide the comprehensive evaluation required for such a complex case. This approach is supported by current recommendations from pediatric neuro-oncology and radiology societies ensuring optimal diagnostic and management planning. Question 11. In the context of pediatric patient preparation and sedation, consider the scenario of Esther Anderson, whose 5-year-old daughter, Lily, is scheduled for an MRI to evaluate suspected neurological abnormalities that might explain her recurrent headaches and balance issues. Lily has exhibited significant anxiety during previous medical encounters, making it challenging for her to remain still. Critical requirement for obtaining high-quality Mr. Anderson is understandably concerned about the risks associated with deep sedation and wishes to ensure that the imaging team uses the safest and most effective protocol. The radiology team has several options available, including minimal sedation protocols, age-specific distraction techniques, such as interactive video goggles and parental presence, and carefully titrated sedation plan if absolutely necessary. Given the need for both clarity and patient safety, which approach best adheres to the American Academy of Pediatrics guidelines for pediatric sedation while effectively managing Lily's anxiety and movement during the procedure? A. Relying solely on physical restraint to keep the child still during the scan. B. Administering high dose of sedative immediately to guarantee complete immobility. C. Employing tailored sedation protocol combined with non-pharmacological distraction techniques and parental involvement. D. Delaying the MRI until Lily is older and likely to cooperate without sedation. Answer. Correct answer, C. Explanation. For pediatric imaging, especially in cases like Lily's where anxiety and movement can compromise image quality, balanced approach is crucial. Option C is correct because it integrates carefully tailored sedation plan with non-pharmacological strategies such as distraction techniques and parental support, thereby minimizing sedation risks while ensuring the child remains sufficiently still. The American Academy of Pediatrics recommends that sedation in children be individualized, with an emphasis on minimizing drug dosage and incorporating behavioral strategies. Options A and B either risk inadequate imaging quality or potential oversedation, and option D may delay essential diagnostic evaluation. This comprehensive approach ensures both safety and diagnostic efficacy. Question 12. According to recent studies, consider the case of MS. Baker, a 9-year-old girl with a history of abdominal pain and inconclusive ultrasound findings in the evaluation of suspected inflammatory bowel disease. Given her age and the inherent risks of radiation exposure in pediatric patients, the radiology team must carefully modify the computed tomography (CT) protocol to minimize radiation while still achieving diagnostic detail of the abdominal structures. The team is debating several strategies, including adjusting technical parameters and utilizing advanced post-processing algorithms. Which of the following modifications is most critical in reducing radiation dose in pediatric CT imaging while maintaining sufficient image quality for diagnostic purposes? A. Increasing the tube current to improve image resolution. B. Utilizing a standard adult CT protocol with no adjustments. C. Extending the scan range to ensure complete visualization of all abdominal structures. D. Lowering the tube voltage and current, implementing dose modulation, and using iterative reconstruction algorithms. Answer. Correct answer, D. Explanation. Pediatric CT imaging requires strict adherence to the ALORA, as low as reasonably achievable, principles due to children's increased sensitivity to radiation. Option D is correct because it describes comprehensive dose reduction strategy. Lowering the tube voltage and current directly reduces radiation, while dose modulation and iterative reconstruction algorithms help maintain image quality despite the lower dose. These modifications are in line with guidelines from the American College of Radiology (ACA) and pediatric imaging safety protocols. The other options either increase radiation exposure or fail to optimize the CT protocol, making option D the most appropriate choice. Question 13. From the perspective of ethical and legal considerations in pediatric imaging, consider the scenario of MS. Rivera, a 2-year-old girl with ambiguous genitalia, referred for imaging to assess potential endocrine and urogenital anomalies. This case is especially sensitive due to the nature of the imaging region and the need for utmost privacy and careful handling of informed consent. The radiology team must navigate the ethical complexities, ensuring that the imaging study provides the necessary diagnostic information. Which approach best addresses the ethical and legal considerations in this scenario while ensuring accurate imaging evaluation? A. Obtaining detailed informed consent from the parents, ensuring privacy during the examination, and using the least invasive imaging modality appropriate for the evaluation. B. Proceeding with the imaging study immediately without detailed consent to expedite diagnosis. C. Referring the patient for a full-body scan to gather as much information as possible in one session. D. Deferring imaging until the patient is older to avoid complications. Answer. Correct answer. A. Explanation. Ethical and legal considerations are paramount when imaging sensitive areas in pediatric patients. Option A is correct because it emphasizes obtaining thorough informed consent, ensuring privacy, and selecting the least invasive imaging method. Practices that are supported by ethical guidelines and legal mandates in pediatric care. This approach not only protects the child's rights but also builds trust with the family. Options B and C neglect critical ethical concerns, while option D delays potentially necessary diagnostic evaluation. Following established protocols and guidelines ensures that the child's welfare remains the primary focus. Question 14. With respect to advanced ultrasound techniques, consider the scenario of MS. Edwards, a 7-year-old patient presenting with a suspected vascular anomaly in her liver. Her hepatologist has requested a detailed evaluation using Doppler ultrasound, potentially with contrast enhancement. To characterize the lesion's vascularity and extent, the radiology team must ensure that the ultrasound study is performed in a manner that maximizes diagnostic accuracy while minimizing risks associated with contrast media. Pediatric patients. Which protocol should be implemented to achieve the optimal diagnostic outcome in this case? A. Conducting non-contrast ultrasound study only to avoid any contrast-related risks. B. Initiating Doppler ultrasound study with the option for contrast enhancement if initial images are inconclusive, while monitoring for any adverse reactions. C. Immediately scheduling CT scan as it provides more detailed vascular imaging. D. Using standard adult Doppler protocols without modifications for pediatric patients. Answer. Correct answer. B. Explanation. Doppler ultrasound, when combined with contrast enhancement if needed, is highly effective for evaluating vascular anomalies while avoiding the ionizing radiation associated with CT. Option B is correct because it outlines a stepwise approach. Start with a Doppler study and reserve contrast-enhanced ultrasound for cases where further clarification is needed. This protocol minimizes risks while ensuring diagnostic accuracy and adheres to pediatric imaging guidelines. Option A might miss important vascular details. Option C unnecessarily exposes the child to radiation. And option D fails to account for pediatric-specific adjustments. Hence, option B is the most appropriate strategy. Question 15. Based on the information, consider the scenario of a preterm neonate in the NICU managed by Dr. Evans, who presents with respiratory distress and suspected necrotizing enterocolitis neck. The fragile condition of this neonate requires an imaging approach that provides critical diagnostic information swiftly while minimizing the risks associated with radiation and sedation. Given the clinical urgency and the delicate physiology of the neon, which imaging strategy should be adopted to assess both the chest for pulmonary complications and the abdomen for signs of neck? A. Initiating an immediate high-resolution CT scan to obtain detailed images. B. Employing MRI to capture all necessary details in one comprehensive session. C. Performing a series of carefully planned conventional radiographs of the chest and abdomen with dose reduction techniques. D. Relying solely on ultrasound evaluation for both chest and abdominal assessments. Answer. Correct answer. C. Explanation. For critically ill preterm neonates, conventional radiography is the first-line imaging modality due to its speed, availability, and ability to be performed with minimal radiation when dose reduction techniques are applied. Option C is correct because it allows for rapid assessment of both pulmonary and abdominal pathology while prioritizing the neonate safety. Although MRI offers detailed images, it is less practical in this setting due to longer acquisition times and potential need for sedation. Ultrasound may not reliably assess pulmonary pathology, and CT exposes the neonate to higher radiation doses. Therefore, option C best meets the clinical needs and safety considerations. Question 16. Under the assumption that early recognition of non-accidental trauma (NAT) is critical in pediatric care, consider the scenario of Ista Henderson, a 4-year-old boy who presents with multiple fractures in various stages of healing. This presentation raises significant concern for possible child abuse. The radiology team must conduct a comprehensive evaluation that includes a full skeletal survey while ensuring that the findings are appropriate. Communicate it to both clinical teams and child protection services. What is the most appropriate imaging and communication strategy in this situation to ensure a thorough evaluation and safeguard the child's welfare? A. Ordering targeted radiographs of only the most suspicious fracture sites. B. Deferring imaging until additional clinical signs are observed to confirm the suspicion of abuse. C. Relying solely on the clinical history without performing imaging studies. D. Immediately performing full skeletal survey and promptly alerting child protection services with meticulous documentation. Answer. Correct answer, D. Explanation. In suspected cases of non-accidental trauma, a complete skeletal survey is essential to detect occult fractures and assess injury patterns. Option D is correct because it stresses the need for an immediate, thorough imaging evaluation coupled with timely notification of child protection services. Meticulous documentation is critical for legal and clinical follow-up. Options A, B, and C risk undervaluation of the child's injuries and delay necessary interventions. This approach aligns with guidelines from the American College of Radiology and child welfare protocols, ensuring both diagnostic thoroughness and child safety. Question 17. From the perspective of pediatric oncology management, consider the scenario of MS. Mitchell, a 6-year-old girl who presents with an abdominal mass and episodes of hematuria, raising strong suspicion for Wilms tumor. The pediatric oncology team requires high-quality imaging to characterize the tumor's extent, assess its vascular involvement, and detect any potential metastasis. Given the complexities of pediatric tumor imaging, include need to minimize radiation exposure while achieving optimal resolution. What imaging modality and protocol should be prioritized in this case to provide detailed diagnostic information? A. Initiating the evaluation with an ultrasound examination, followed by contrast-enhanced MRI. Further detail is needed. B. Relying exclusively on non-contrast CT imaging to reduce radiation exposure. C. Using standard adult imaging protocols for CT with contrast enhancement. D. Deferring imaging until the child is older to reduce radiation risks. Answer. Correct answer, A. Explanation. For pediatric tumors such as Wilms tumor, ultrasound is often the first-line modality because it is non-invasive and free of ionizing radiation. Option A is correct as it describes a stepwise approach, beginning with ultrasound to assess the mass and following up with MRI if additional anatomical detail is required. MRI offers excellent soft tissue contrast without radiation, making it ideal for further delineation of the tumor and its vascular involvement. Options B and C involve unnecessary radiation exposure, and option D delays crucial diagnostic evaluation. This protocol aligns with current pediatric oncology imaging guidelines, ensuring both safety and diagnostic accuracy. Question 18. Considering the evidence, consider the scenario of Ista Scott, a 10-year-old boy with a long-standing seizure disorder and developmental delays, who is scheduled for an MRI to evaluate potential structural brain abnormalities. Given Ista Scott's difficulty in remaining still due to both anxiety and his underlying neurological condition, the radiology team must devise an MRI protocol that minimizes motion artifacts while addressing sedation risks. Which strategy should be implemented to optimize the MRI study for this pediatric patient in line with recent guidelines from the Society for Pediatric Radiology? A. Utilizing standard MRI protocols without modification, assuming the patient will cooperate. B. Incorporating fast imaging sequences, carefully titrated sedation if necessary, and employing motion correction techniques to minimize artifacts. C. Postponing the MRI until the patient can remain still without sedation. D. Replacing MRI with ET to avoid sedation-related complications. Answer. Correct answer. B. Explanation. In pediatric patients like Ista Scott who struggle to remain still, it is critical to use optimized MRI protocols that reduce motion artifacts. Option B is correct because it recommends the use of fast imaging sequences, judicious sedation when necessary, and motion correction techniques. This approach is endorsed by the Society for Pediatric Radiology and is designed to balance the need for high-quality images with patient safety. Options A and C either risk poor image quality or delay diagnosis, and option D unnecessarily exposes the child to radiation. Therefore, a targeted strategy as described in option B is optimal. Question 19. Throughout the course of pediatric neuroimaging, consider the scenario of MS. Murphy, an 11-year-old girl undergoing evaluation for developmental delays and supple motor deficits. Her pediatric neurologist suspects that her symptoms may be related to abnormal brain maturation and possible white matter dysmyelination. Given that the patterns of brain development, particularly myelination, vary significantly with age, it is crucial to select an imaging protocol that can accurately capture these subtle developmental differences. Which of the following approaches best accounts for her developmental stage while ensuring optimal visualization of white matter tracts and cortical structures? A. Relying solely on conventional CT imaging with contrast. B. Employing standard adult MRI protocols without age-specific modifications. C. Utilizing high-resolution MRI with age-adjusted sequences including TT and diffusion tensor imaging (DTI) to assess brain maturation accurately. D. Deferring imaging until the developmental delays become more pronounced. Answer. Correct answer C. Explanation. Accurately assessing pediatric brain development requires imaging protocols that are specifically tailored to the child's age. Option C is correct because it outlines the use of high-resolution MRI with age-adjusted sequences including diffusion tensor imaging (DTI), which is particularly sensitive to white matter integrity and maturation. This approach allows for detailed visualization of both cortical structures and white matter tracts, aligning with current pediatric neuroimaging guidelines. Options A and B are inadequate as they do not consider the unique developmental aspects of the pediatric brain, while option D unnecessarily delays diagnosis. Thus, option C is the most appropriate method for this scenario. Question 20. Examining the consequences of pediatric vascular anomalies, consider the scenario of Mr. Wilson, the 13-year-old boy with a history of congenital vascular malformations who now presents with worsening pain and swelling in his lower extremities. His symptoms suggest that the vascular anomaly may have progressed, potentially causing hemodynamic compromise and requiring interventional treatment. The pediatric interventional radiologist must on an imaging modality that not only provides detailed diagnostic information but also facilitates minimally invasive therapeutic intervention. Which imaging modality and procedural approach should be prioritized to balance diagnostic accuracy with procedural safety in this case? A. Relying solely on ultrasound-guided evaluation without any cross-sectional imaging. B. Initiating a diagnostic CT angiogram using standard adult protocols. C. Performing a diagnostic MRI without interventional planning capabilities. D. Utilizing a combined approach with catheter-based digital subtraction angiography (DSA) for both diagnostic mapping and potential therapeutic intervention under pediatric protocol. Answer. Correct answer D. Explanation. For pediatric patients with complex vascular anomalies, a combined diagnostic and therapeutic approach is often required. Option D is correct because catheter-based digital subtraction angiography (DSA) provides high-resolution vascular mapping that is critical for both diagnosis and guiding interventional procedures. Pediatric-specific protocols are used to minimize radiation and contrast risks. Options A, B, and C do not offer the same level of integration between diagnosis and intervention or may expose the child to unnecessary risks. This approach is supported by guidelines from pediatric interventional radiology societies and ensures both diagnostic accuracy and procedural safety. Question 21. A multinational electronics manufacturer is evaluating different transportation modes for shipping high-value semiconductor components from its factory in Taiwan to distribution centers in Europe. The company prioritizes speed, security, and reliability but is also concerned about cost. Which transportation mode is most appropriate for this shipment? A. Ocean freight with insurance coverage. B. Rail transport via the China-Europe Railway. C. Air freight with premium security handling. D. Trucking via an intermodal container system. Answer. Correct answer C. Explanation. Air freight is the best choice for high-value, time-sensitive shipments like semiconductors. It offers speed, reliability, and security despite being more expensive. Ocean and rail transport are cost-effective but slower, and trucking is impractical for long international distances. Question 22. A global e-commerce company is struggling with high costs in its reverse logistics operations. Customers frequently return products due to minor defects, and processing these returns is expensive. What is the best strategy to improve reverse logistics efficiency? A. Implement stricter return policies to reduce return rates. B. Establish regional return processing centers. C. Discontinue return acceptance for low-value items. D. Increase restocking fees to discourage returns. Answer. Correct answer B. Explanation. Establishing regional return processing centers reduces transportation costs and improves efficiency. Stricter policies or eliminating returns may damage customer satisfaction, while increasing restocking fees may not directly address operational inefficiencies. Question 23. A distribution center is experiencing bottlenecks in its picking process. The warehouse has a mix of high turnover, fast moving, and low turnover, slow moving inventory stored together. What layout adjustment would best improve efficiency? A. Store fast moving items near the shipping area. B. Increase storage density to maximize space utilization. C. Move all slow moving items to an external facility. D. Implement a random storage allocation system. Answer. Correct answer A. Explanation. Positioning fast-moving items closer to the shipping area reduces travel time for order pickers, improving overall efficiency. Increasing storage density may limit accessibility, and external storage or random allocation does not address the core issue. Question 24. A retailer is launching a new product line and lacks historical sales data for accurate demand forecasting. Which forecasting method is most suitable in this case? A. Moving average based on past sales trends. B. Delphi method using expert opinions. C. Linear regression based on past demand patterns. D. Exponential smoothing for real-time adjustments. Answer. Correct answer B. Explanation. The Delphi method, which gathers expert insights, is effective for new products with no historical data. Methods like moving average, regression, and smoothing rely on past sales data, making them unsuitable in this scenario. Question 25. A company wants to improve its inventory turnover ratio without negatively impacting service levels. Which action is most effective? A. Increase order frequency and reduce order quantities. B. Decrease demand variability by limiting customer orders. C. Consolidate inventory into fewer distribution centers. D. Reduce supplier lead times without changing order policies. Answer. Correct answer A. Explanation. Increasing order frequency while reducing order quantities helps maintain steady inventory flow, preventing overstocking and improving turnover. The other options do not directly address inventory movement efficiency. Question 26. A car manufacturer implements a just-in-time JIT inventory system to minimize holding costs. However, a supplier's unexpected production delay leads to halt in assembly line operations. Which strategy would best mitigate this risk? A. Increase safety stock for all components. B. Establish backup suppliers for critical parts. C. Reduce production levels to align with supply constraints. D. Extend lead times for supplier deliveries. Answer. Correct answer B. Explanation. JIT systems are vulnerable to supply disruptions. Establishing backup suppliers ensures continuity without increasing excessive safety stock, which contradicts JIT principles. Reducing production or extending lead times does not solve the supply chain risk. Question 27. A retailer ships large quantities of goods from warehouses to stores, but is facing rising transportation costs. Which solution would best reduce these costs? A. Increase the use of less than truckload (ETL) shipments. B. Consolidate shipments into full truckload (FTL) deliveries. C. Reduce shipping frequency by holding more inventory. D. Use premium carriers with faster transit times. Answer. Correct answer B. Explanation. Full truckload (F2L) shipments are more cost-efficient than ATL for large volumes as they reduce per-unit transportation costs. Increasing inventory may lead to higher holding costs, and premium carriers would increase costs. Question 20. A pharmaceutical company needs to transport vaccines requiring strict temperature control from manufacturing plants to hospitals. Which transport method is most appropriate? A. Standard air freight with insulated packaging. B. Refrigerated trucks with real-time temperature monitoring. C. Intermodal rail with controlled environment containers. D. Ocean freight with passive cooling systems. Answer. Correct answer B. Explanation. Refrigerated trucks with real-time monitoring ensure continuous temperature control, which is critical for vaccines. Standard air freight may lack real-time monitoring, and ocean or rail transport may be too slow for sensitive medical shipments. Question 29. A company sourcing key materials from a single overseas supplier is concerned about supply chain disruptions. Which strategy would best reduce risk? A. Dual sourcing from multiple suppliers in different regions. B. Holding higher safety stock levels. C. Negotiating longer-term contracts for price stability. D. Switching to local suppliers with higher costs. Answer. Correct answer A. Explanation. Dual sourcing diversifies supply risk and reduces dependence on a single supplier. Safety stock is a short-term fix, and price stability does not address supply disruptions. Question 30. A logistics firm wants to reduce its carbon footprint while maintaining cost efficiency. Which approach is most effective? A. Transition to electric and hybrid delivery vehicles. B. Increase reliance on air freight for faster deliveries. C. Use more single-use packaging for lighter shipments. D. Shift to fossil fuel-powered trucks for bulk deliveries. Answer. Correct answer A. Explanation. Electric and hybrid vehicles reduce carbon emissions without significantly increasing costs. Air freight and fossil fuels have higher emissions, while single-use packaging contributes to waste.